Transitions of care and handoffs represent a vulnerable time for patients. Through coordinated teamwork and a structured handoff process, we can minimise miscommunication and maximise safety during patient transfer from the operating room to the intensive care unit.
So I think we probably should go to an ICU.
I totally agree. I don't think he needs to be extubated, given his hemodynamic instability and the massive blood loss. I think he needs to go to surgical ICU.
Great. Do you think we can organize an ICU bed for this patient?
Sure, Dr. Smith. I'll go call the charge nurse and I'll get that process started. Which ICU bed do you want him to go to, Dr. Delaney?
Surgical ICU.
The OR circulating nurse will place a bed request order once the decision is made to send the patient to the ICU and contact the charge nurse.
ICU charge nurse Barbara, as well as the OR nurse Grace on the line. The patient will be transferred to room 9411.
Bed drip, but they're going to be sending him up intubated, so he'll still be on the protocol drip.
Dr. Smith and Dr. Slay, we have a SICU bed for the patient now.
Great, I will call the ICU.
Okay, great, thanks.
How much longer do you have?
Maybe about an hour.
And do you have anything from your end that should I convey to the team?
No, I don't think so. Other than the blood loss, and we have a couple packs, and I mean, I think that's about it. We'll come up and sign out to the ICU team.
Okay.
The anaesthesiologist will call the ICU team and provide a brief report. 15 minutes prior to leaving the OR circulator will call the ICU charge nurse and alert them that the OR team is on their way up to the ICU.
I'll inform the nurse, our team, and the respiratory therapist.
Once the patient is appropriately settled into the ICU and all team members are present, the ICU team representative should lead the handoff based on the ICU bedside handoff tool.
I have the ICU handoff tool here. Why don't we all introduce ourselves? I'm Joe Meltzer. I'm the ICU attending.
I'm Marissa. I'm the SICU fellow.
I'm Benjamin. I'm the SICU resident.
I'm Ali Sally, anesthesia attending.
I'm Joe Pantoja, surgical resident.
I'm Grace. I'm the ICU nurse. Let's verify the patient. This is John Reagan, MRN 555-4321.
The surgical team will give reports including the following components of the ICU bedside handoff tool.
So Mr. Reagan's a 56-year-old man with an incidentally found retroperitoneal mass.
The anesthesia team will give report including the following components of the ICU bedside handoff tool.
Okay, time for questions. Let's take a look at the drain.
Okay, so we have 2 JP drains
Okay.
in the right lower quadrant.
I see about 25 cc's of serosanguinous fluid.
The ICU team summarises the OR team's reports and outlines the immediate plan of care to signify they are now taking over the patient's care.
Great, so the SICU team will be primary for any concerns since we're here all night. We'll inform the surgeons of anything, and our SICU phone number is 79992.
The person leading the ICU bedside handoff will summarise the immediate plan of care, prioritise clinical concerns and management plan, including admission orders before ensuring all questions have been answered and announcing handoff complete.
So let's summarize the patient. We have a patient here with significant unexpected intraoperative blood loss. We're going to keep the patient should be in. Are there any changes with the orders we need?
Yep, the ICU orders are in. We don't need any additional orders at this time. Thanks.
Does anyone have any questions or concerns at this point?
No.
Okay, handoff's complete.